favorite DBT skills to teach teens is changing our emotion with opposite action. And I really love teaching this in group because we practice it in the group and we rate our feelings when we come in and then after practicing the skill. And I love to see the teens notice and experience in the moment and in the group that the skills actually work, that when they engage in an activity that is the opposite of what they're feeling and that they get to laugh and enjoy and do things in the group and challenge themselves, that their feelings actually improve, and they get to see that, they get to see it work in themselves, and they get to see it work in their peers in group, and really know that these are things and tools that can help them, not just in that moment in group, but outside of group and with their struggles in their daily life.
When it comes to regulating emotions, this can be one of the hardest things that our teens have to learn. And that's why I really love the check the facts skill. Check the facts plays into our natural ability to gather information about things that we're concerned about. It asks us a series of questions that we can use to evaluate a situation and check whether our thoughts or feelings are actually in line with the situation, or if maybe there's a better way to approach it and maybe we should be engaging in some emotion regulation skills instead. It's a little bit like a fancy therapeutic reality check. In the process of Check the Facts, we ask a series of questions like, is there evidence for the things and thoughts I'm having? Is there evidence against the thoughts I'm having? What kind of things would someone I trust say if they could be inside my head right now and feel and think the things I feel? Did I get this idea from myself or from somebody else? Am I basing this in facts or in feelings? These questions allow us to determine whether or not the thought process we're having, the idea we're struggling with, the intrusive thought that we're wrestling is valid or not, and how we want to take steps from there. So when it comes to emotion regulation, one of the first steps you can do is look at the situation and decide, is this the emotion I want to have in response?
When we are in distress, it is often difficult to calm ourselves down using cognitive restructuring or talking to ourselves, saying that we're safe, and that is when we need something called distress tolerance skills. I'm Allison, a therapist at Mindful Healing, and today I'd like to review something called our TIP skills. TIP skills are an acronym that stands for temperature, intense exercise, paced breathing, and progressive muscle relaxation. These 4 things are what we call distress tolerance skills. They're a way to calm down our brain when our amygdala is activated and our fight or flight response is on. Now, when we talk about the skill temperature, we're talking about using cold temperatures. We want something to shock our body so that our body has to pay attention to regulating itself instead of what might be going on in our brain, such as our fight or flight response. In terms of intense exercise, it does not need to be a lengthy hour-long workout, just something to activate your heart rate, get your blood pressure up, and start to make yourself feel more in tune with your body and your physical sensations instead of the mental sensations going on that are making us panic. I often recommend to clients using progressive muscle relaxation and paced breathing in conjunction together. They are both very relaxing and very calm skills that you can use in any environment in order to soothe our brains and take us out of distress. For more information about distress tolerance skills and our TIP skills, check out the website below at Mindful Healing.